Ever heard the problem of antimicrobial resistance? Because of the empirical treatment without scientific evidence, many bacteria became resistant to antibiotics, which are not appropriately prescribed, and few options are left to treat the resistant bacteria. This is a problem of antimicrobial resistance, or AMR. Without appropriate measures, nearly 10 million people may die globally in 2050, surpassing the number of deaths caused by cancer. According to an estimation, GDP losses will exceed $100 trillion. Because of this, WHO and the Japanese governments developed the AMR action plans and started to take measures. By leveraging image recognition AI, BiTTE has developed the medical device software BiTTE. By using the image recognition AI, we aim to reduce the improper antibiotics prescription and prevent the occurrence of AMR. Let's look at how BiTTE will change the prescription practice. First, the conventional case. The patient X suspected with bacterial infection came to the hospital. The physicians need to prescribe antibiotics immediately. What is a causative bacteria? The physicians create a slide specimen after collecting samples from the patient. Then the patient will fix the specimen and prepare the Grimstone slide for observation. With a microscope, the physicians observes and identifies causative bacteria. However, it's difficult to identify, especially in primary care and outpatient settings. A few possible bacteria came to the physician's mind. It's better to order a culture test to identify the causative bacteria, but it takes 1 to 3 days to get the result. But antibiotics should be prescribed right now. There is no good choice, but let's prescribe antibiotics A based on the past experience. This is so-called empirical treatment. The same patient visits a hospital since he didn't recover after the first visit. Let's look at BiTTE's case. The patient X suspected with bacterial infection came to the hospital. The physicians need to prescribe antibiotics immediately. What is a causative bacteria? Specimen preparation and Grimstone are the same as conventional process. Let's have BiTTE identify the causative bacteria, and the physicians attach the BiTTE instead of the smartphone to the microscope. 5 possible causative bacteria are shown in the display with certainty. Certainty is influenced by the amount of training data. The top one is Klebsiella pneumonia, and the certainty is very high. The following bacteria certainties are low. The causative bacteria should be Klebsiella pneumonia. It's helpful to have this information in the diagnostic results. Besides identification, BiTTE also provides data from antibiogram. Physicians only need to choose antibiotics with a high antimicrobial susceptibility. Let's prescribe antibiotics B based on this antibiogram. In this way, it's certainly important to have a treatment decision based on the past scientific evidence and data. The culture test results also reveal that the causative bacteria is Klebsiella pneumonia. 2 days later, the patient X recovered shortly after that. It's useful to have this sort of application and use evidence data to identify causative bacteria at an early stage. Physicians can identify causative bacteria and select appropriate antibiotics with BiTTE. In addition, by encouraging a proper prescription of antibiotics, it's expected to reduce the occurrence of AMR, with the power of AI to achieve antibiotics stewardship. BiTTE.